And now I'll introduce today's special guest, who joins us as part of our Ontario Ministers Series 2008. Over the past month and a half, we've also heard from George Smitherman, Minister of Energy and Infrastructure, and Ontario's Finance Minister, Dwight Duncan. Today, we hear from the Honourable David Caplan, who in June took over his new post, switching portfolios with George Smitherman. His predecessor brought a unique style to the health portfolio, as health sector leaders around the province can readily attest. But David Caplan has brought his own style and discipline to this very critical post, just as he did during the 4.5 years immediately prior as Minister of Public Infrastructure Renewal. In both of these massive portfolios, we can be sure that David Caplan has never been bored and has never lacked for things to do. It's also worth noting that there is a proud family tradition associated with the portfolio Minister Caplan now holds. His mother, the Honourable Eleanor Caplan, was Provincial Health Minister from 1987 to 1990 and was a major force in shaping health care in this province. The apple apparently doesn't fall far from the tree. As Health Minister, David Caplan has had some early success with the $1 billion contract deal struck between the province and the Ontario Medical Association, and we are watching and hoping for more success as he tries to whittle down wait times, ramp up the number of nurses, and roll out an additional 50 family health teams. Not easy in the best of times, and these are not the best of times. Healthcare has always been an expensive proposition, and in our current economic climate, it will be even tougher to maintain, never mind increase, services. But if his past achievements are any indication, Minister Caplan is up to the challenge of championing healthcare in a time of financial frailty. Please join me in welcoming the Honourable David Caplan, Ontario Minister of Health and Long-Term Care, as he discusses the Liberal government's broad vision for Ontario health. And I will remind you all, or tell you all at this point, that the Minister is happy to take a few questions, time permitting, after his remarks.
Okay. Just grew taller. Good afternoon, ladies and gentlemen. It's a tremendous pleasure and an honor for me to be here today. I know that the Canadian Club has facilitated some of the key public policy debates of our time, and it really is a privilege for me to be able to engage discussion on the future of healthcare in Ontario. But before I begin, let me start by thanking Helen for her very generous introduction. Like so many of you here today, Helen has committed herself and her energies to public service as chair of Ontario's Trillium Foundation and the president of this club. And for that, we owe you, Helen, a tremendous debt of gratitude. So let me start by saying thank you. I would also like to thank Alan Odette, past president of the club, who's with us today, who's representing GlaxoSmithKline. Alan, thank you as well. I have quite a bit of ground to cover, and I want to make sure that I leave enough time for Q's and A's. So let's get started. I've got about 15 to 20 minutes, depending how quickly I do it, worth of remarks. But you know, I'm often struck. There's a very famous story. It goes around Queen's Park about a minister who had 20 minutes worth of remarks. He asked a speechwriter to provide it for him. It seemed when he gave the remarks, the poor fellow went on for an hour, and boy was he embarrassed, because this half of the audience fell asleep, while this half of the audience, in disgust, simply got up and left the room. And the minister was terribly embarrassed, and the next morning got into his office, called up his speechwriter, and chewed the poor fellow out like you would not believe. The speechwriter was dumbfounded and said, "I don't understand it. I gave you 20 minutes worth of remarks and 2 additional copies." Well, I want to assure you that I only have 1 copy of my remarks today. And today's theme is broad vision for healthcare. But before I get into the broad vision, I'd like to start with something a little bit more specific: the emergency departments of our hospitals. Our ERs have become, literally, a metaphor for what ails our healthcare system. Our ERs have become the default doorway through which too many Ontarians enter and then leave the healthcare system. A person with a sprained finger is coming through the same door as someone having a heart attack. and Ontario's emergency departments see approximately 5 million patients every year. But more than half of those visits, as estimated, are not medical emergencies. So think about what that means. The backlogs, inefficiencies, the frustration for patients, for medical professionals, for policymakers. That's why many of my priorities as Minister of Health will relate in one way or another to hospital emergency departments. It's the biggest and, in my opinion, the most urgent challenge facing the entire system. Now, since 2003, approximately 5 years ago, I would note that through the efforts of my predecessor, Minister Smitherman, we have made enormous progress in rebuilding and refocusing our healthcare system. As a government, we've set two overarching priorities: reducing wait times, especially in our emergency departments, and improving access to family health care for all Ontarians. We've seen vastly increased resources, annual spending for health care by over $11 billion. That's a dramatic 37% increase. And we're seeing results from these investments. We've increased the number of frontline medical workers. We've funded over 8,000 new nursing jobs, 7,000 jobs in long-term care homes. We've undertaken the largest expansion of community health centres in the history of the province, benefiting 103 communities. We've reduced wait times for key surgeries. $1 billion alone has been devoted to this initiative. Many of our hospitals have sprouted construction cranes, all part of the single largest expansion of healthcare capital in generations. We've created 150 family health teams. That means that 630,000 Ontarians now have access to a family doctor who did not previously. We've increased community input through local health integration networks. But as always, there is much more work to do. So I've spent the last 4.5 months learning and planning and strategizing for 2009, which I expect is going to be a very busy year in healthcare. We must continue realizing our vision of a modern, accessible, sustainable healthcare system that delivers the highest quality of care available in the world. That's no idle boast, but it's no easy feat. But we owe it to ourselves, we owe it to our public whom we serve, we owe it to future generations to do no less. Now, when I assumed the responsibility as Minister of Health, I sought the advice of a former Minister of Health who shall remain nameless. Son, she said, there are literally thousands of urgent issues to be addressed in healthcare. But if you try to spend your time and attention and your energies to fix all of them, you'll find at the end that you will have accomplished very little. Be strategic. Don't be overwhelmed by the daily crises. Rather, choose a number of key priorities that matter to you, priorities that will have long-term, lasting impacts and benefit the greatest number of Ontarians. So I thought that that was very sound advice. So I've decided that I'm going to focus my attention and energies on three key and important areas. First, chronic diseases, chronic disease management, and starting with diabetes. Earlier this summer, I hope you would have noticed that I launched a comprehensive diabetes strategy to help the almost 1 million Ontarians living with this disease. The $741 million investment will sustain a 4-year strategy to prevent, to manage, and to treat diabetes. We're starting with increasing access to insulin pumps, and we'll be launching a diabetes registry later in 2009. Better management of chronic diseases will help to ease emergency department wait times by diverting patients into more appropriate settings. Second, electronic health. By 2015, according to the Ministry of Health and Long-Term Care, Ontarians will have an electronic health record. I believe we can be more ambitious than this. Frankly, we haven't moved nearly as quickly as I'd like on it. So we need to redouble our efforts to make up for lost time. And that's why I'm confident, under the leadership of Dr. Alan Hudson, the chair of eHealth Ontario, and Sarah Kramer, our new president and CEO, both of whom are here today, we will modernize this critical aspect of the system. But leadership is not going to be enough. We need partnerships with health stakeholders, with technology providers. And I see today's sponsors, and I had a chance to very briefly chat with Francois, president of Emergis, and I met earlier his colleague Dave Cunningham agreeing with me that we all need to work together. E-health involves enormous costs, but it will produce, in my opinion, equally large savings. And most importantly, it will lead to innovations in the quality of healthcare. It has literally the potential to transform our healthcare system and support many other health-related strategies, like our diabetes registry, like new models of care, like an enhanced ability to track patients and monitor incidents of disease and illness, which will all help to ease the ER crunch. The third area that I've decided to spend some time and attention and to tackle is mental health and addiction. It directly affects 1 in 4 of us. It's an issue that touches us all, directly or indirectly, whether we know it or not. The mentally ill represent among the most vulnerable in our society. And I truly believe that the way that this issue is in many ways a measure of us as a compassionate society. This, too, will help divert patients from the ER to alternative strategies, to alternative settings for care and for treatment. Now, by focusing on these 3 key areas, we'll be addressing the most pressing challenge we face in emergency departments by giving patients the options to access the healthcare system through more appropriate entry points, and by giving Ontarians the opportunity to avoid entering the healthcare system altogether. So let me be clear. We are going to solve the ER challenge. But the problem of emergency departments cannot be solved by governments alone, nor by hospitals working in isolation. It's going to require all of our efforts through a coalition, through partnerships, and through teamwork. Now, if I've learned anything in my time, in my previous role as the Minister of Infrastructure, it's the value of teamwork. Building infrastructure requires the coordination and concerted efforts of bankers, of architects, of engineers, a whole host of professional trades and many others, all working toward a single goal. Likewise, solving the ER conundrum requires a combination of leadership and partnership. Just ask Tom Clausen, President of and CEO of the Ontario Hospital Association, who is with us today, what partnership can accomplish. The OHA has been a strong partner of the Ontario government. And that's one of the reasons that we've got so many major hospital projects underway and so many in the procurement pipeline, more than 100 in all. Or ask Linda Haslam-Stroud, President of Ontario Nurses Association, who's also come to participate in today's discussions. She and her members have been absolutely critical in transforming healthcare. Thousands of new nurses and thousands more to come, helping us to take on some of the toughest challenges that the system faces. Infection control, wait times, and the list is endless. As the largest group of regulated healthcare providers, nurses are the front lines of healthcare, and their partnership is critical to the future of our public healthcare system. Or ask Jonathan Guss, CEO of Ontario's Medical Association, also here today. Last month, and Helen mentioned earlier, we reached a new agreement with Ontario's doctors that includes a shared commitment to help 500,000 additional Ontarians who currently don't have a family physician to be able to find one. That commitment is the driving force behind a new program that I'll be launching in the new year. So I'll tell you a little bit about it. It's called Healthcare Connect. This unprecedented initiative will connect patients with family health care providers in their communities who are taking on new patients. And for the first time in Ontario, people struggling to find a family doctor will have a single place to turn to find real solutions. I'm also going to be working hard in the new year to ensure that Ontarians are better informed about alternatives to emergency departments, such as urgent care centres and walk-in clinics. So the Ministry of Health, Long-Term Care and Local Health Integration Networks, nurses, doctors, patients, and hospital administrators, all working together toward a common goal, applying innovative and creative approaches to problem solving over reflexive demands for more funding. And examples abound. So let me share one with you. The Timmins District Hospital, like so many others across the province, was experiencing a severe bed shortage. 50% of its acute care beds were being occupied by patients who didn't actually require acute care. And 80% of its emergency stretchers were being used by patients who didn't need emergency treatment. So working with the Northeast Local Health Integration Network, the hospital accessed a new strategy called wraparound funding. As its name implies, the strategy provides support to help get patients out of hospitals and into more appropriate settings. Nursing care, social services, housekeeping help, personal support, even equipment like wheelchairs and special mattresses are funded through wraparound. Within 2 weeks, the hospital began to discharge patients. And within months, the hospital was able to eliminate wait times for ER beds. The total amount of funding, $233,000. Think of it. But the impact, well, you can applaud for that. The impact of that relatively small amount of funding produced exceptional value for money for the hospital and, more importantly, for the patients. The program has been so successful that the LHIN is recommending the program be expanded to hospitals in Sudbury, North Bay, and in Sault Ste. Marie. There are lessons in the leadership and the partnership to be learned from Timmins and District Hospital, and the lessons in innovative thinking and problem solving. These approaches are all the more critical as we face tough economic times. Now, as you heard last month when Minister Duncan produced the fall economic statement, we're entering a belt-tightening period. When we formed the government about 5 years ago, we inherited a $5.5 billion deficit that was hidden from public view. And through the time of our first mandate, we worked very hard to eliminate that deficit. So you can all imagine how difficult a decision it was for Minister Duncan and our government as a whole to post a $500 million budget deficit this year. It was a tough decision, but I truly believe it was the right decision in order to protect health care and education, two priorities that Ontarians hold dear. Belt-tightening is what Ontario families do when faced with tough times, and that's what we're going to do in the Ministry of Health. We'll spread out the hiring of 9,000 new nurses over a longer period of time than we had originally anticipated. We'll be slowing the addition of some family health teams, but let me be very clear. We are moving forward, just simply not as fast as we would have liked. We're spending 46 cents of every program dollar in Ontario on health, the highest level ever. We're still hiring thousands of nurses. We're still adding family health teams. We're still renewing hospital infrastructure. And what we will not do is what the previous government did. We will not borrow money to fund tax cuts and then make drastic cuts to healthcare and education to balance the books. Everyone has a choice, and our choices are clear. Even in these difficult times, we will continue to invest in health care, and we will do so in a prudent and responsible manner, because now more than ever, we need leadership and we need partnership. Now more than ever, we need the federal government to step up. Ontario families continue to be shortchanged by more than $700 million each year in health transfers alone. Federal Finance Minister Flaherty's recent equalization announcement fell short of the mark. If we had a willing and engaged partner in Ottawa, I say to you, ladies and gentlemen, we could do a lot more, and we could do it a lot faster. As it is, we have a federal government that has been missing in action for far too long. Because the challenges that we face in healthcare in this province, in these economic uncertain times, are too great for any of us to shirk our responsibilities. Ladies and gentlemen, I'd like to end my remarks today by borrowing from someone whose intelligence and humanity we would all acknowledge. Albert Einstein, who said, "We can't solve problems by using the same kind of thinking we used when we created them." In that vein, the challenges we face today require us to be bold, to be innovative, and to come together. Together, it's going to be the way that we will navigate through the turbulence and emerge with a strengthened healthcare system. There is much that can divide us, but there is more that can unite us. As leaders and as partners, we need to work together. There's so much to say on this topic, but at this point, I'd like to do what I normally do, which is to listen and to be able to engage in a dialogue, and I'd like to hear from many of you. So on that note, I'd like to end my formal remarks, and I'd like to take your questions, and as I often do say, if you do have questions, I do have answers. Thank you so much for being a wonderful audience today. So how do you want to do it? Okay. All right.
If anyone has any questions, please raise your hand and we'll have a handheld mic brought to you. So we have somebody over here.
Hello, my name is Gary Malkowski, and I'm from the Canadian Hearing Society. Mr. Minister of Health, I'd like to ask what your vision is in for the role of community health.
I think that's an excellent question, because oftentimes the healthcare system, as we've conceived it and as we've supported it, has been through the institutions largely set up by the province, but it is in fact the community organizations and community providers which are going to provide us much of the key. So for example, we've started something that we call Aging at Home. Aging at Home is a $1.1 billion investment over the course of 4 years in community health providers that will help to be able to keep seniors living independently at home within their own communities. I hope you, Gary, had a chance to read an excellent series in the Toronto Star, where they talk about in a number of countries in the world where they have used many of these kinds of strategies. We are just in the beginning, but it is through supporting community agencies and community partners that I really think that we're going to see many of the best benefits that are yet to come. And that's just one example of what I think will be many more attempts to shore up and support and to create the capacity at the community level to be able to support Ontarians of all walks of life.
Any other questions?
Wow. Then enjoy dessert.
No, there's one other coming, at least one other.
My staff cannot ask me questions.
Hi, Mr. Minister. I'm from Pathways Education, Canada, and I was very entertained by the ads for the doctor's offices, and it said "Help Wanted." I was just curious in respects to what the ministry is doing to meet that pressing issue of the shortage of doctors that we will probably be facing in the future?
The single greatest challenge I believe that we face and have yet to be confronted with is a human resource challenge. Where, and an incredible stat that when we first began our healthcare system in this country, for every one person retired, there were 8 people in the workforce. At present, for every one retired, there are 5 people in the workforce. And the year 2012, the first year when the baby boom generation will retire, and I'm at the tail end in 1964, by the time that is well underway, for every one retired, there will be 3 people in the workforce. So think about what the implications are. You not only have a system has to be financially supported by fewer people, but you're literally going to have fewer people available to provide the care, available to provide, and that we're going to require throughout the entire system. And this is not unique to Ontario or to Canada. This will be a worldwide phenomenon. So we're trying to get ahead of it right now by doing a couple of things. Number one is we know that we are able to attract, because of the quality of life that we offer, people from around the world who have had the investment and the support in their own home countries. So we're working with our professional college, the College of Physicians and Surgeons, and many others of the other professional colleges, to be able to help to license and to integrate and to create the ability for folks to be able to have their credentials recognized, to be able to meet Ontario standards, and to be able to practice faster. And in fact, I believe a third reading debate is taking place today on Bill 97, which would help and assist in this regard. That's one strategy. The other strategy is that, unfortunately, back in the early 90s, the government of the day made a fundamentally very wrong decision, which was to reduce the number of training spaces available in our medical schools. What this caused, it was thought at the time to be able to contain costs, but what it did was it led us down the path of a critical shortage of medical personnel. So we've worked very hard over the first couple of years to expand the number of medical school spaces within Ontario's universities, and have created a northern medical school. The philosophy is that we will be able to support the healthcare needs of people in the north if we have places where people from the north will be able to get the kind of training and then go back into practice. And that seems to be holding true. The first graduating class will be coming out in the first couple of years, but if any indication from the early recruitment efforts by some of the local healthcare providers, it seems that philosophy will hold true. So we have a plan to create additional spaces in Ontario's medical schools to train more doctors, and that's going to be truly another area. And I guess the third area is, what can we do currently to be able to recruit and retain the medical professionals that we have? And I was really struck earlier this year when I had a chance to participate with Mount Sinai and the Hospital for Sick Children, where, because of some of the efforts to revitalize our infrastructures, create modern facilities, and also support the research efforts, that they were able to attract one of Canada's leading neonatal specialists. And we have begun to see, I guess, what would be termed a brain gain in Ontario, because we now have the opportunity to support the kind of research and the kind of care that these physicians wish to be able to do. And we're not actively going out and recruiting from other places in the world, but we are making it possible for them to want to come here to be able to set up practice. So those are the 3 ways that we're doing it. And I guess the fourth one is, for the very first time ever, in the agreement that we signed with the OMA, we have the interests of the Ontario Medical Association and the interests of the Ontario government completely aligned in the same direction, which is incredibly helpful. Because if we are going to solve these problems, it is going to take that kind of a partnership, which is going to be able to do that. So I really thank you for the question, because very, very much it is uppermost in my mind, the HR challenge that we're going to have in years to come.
Question at the back.
Yes, Mr. Minister, thank you very much for your remarks and comments. My name is Harry French. I'm working in a consulting capacity with some of the LHINs on the topic of engagement. You mentioned engagement in your opening remarks, and I think the importance of engagement is one of the strategies in terms of transforming health here in Ontario. It's interesting that the Act, though, defines what the LHINs should do and the health service providers within the LHINs to engage their communities, which includes employees and practitioners and so on, but it doesn't define the how. At least some may debate that, but I'm going to ask you, what's your dream around how engagement will take place through the words that were established in the Acts for the LHINs?
Sure. Well, Harry, that's a great question, and I think it's important that the Act not define how it's done, because it will happen within the diversity that is Ontario. And Ontario is an incredible place, and we have large urban centres, and we have rural, and we have remote communities, and we have a diversity that runs the entire spectrum of the world. And when I had a chance to speak with the LHIN chairs and CEOs, and we talked about this very same topic, and I said to them, I approach things as a politician, where I think about my election campaign, and I'll go and knock on individual doors in order to engage people in Don Valley East that I represent. But I'll also meet with them in small groups. I'll meet with them around natural communities which have formed, and I'll meet with them in larger forums. And my expectation for LHIN, for local health integration networks to be able to engage in those ways and in all of the other conceivable ways that they have to be able to truly reach out and to truly be able to have meaningful engagement. And I want to stress the word meaningful. In order for the larger public, and it's not simply the healthcare providers or the healthcare community, they must make the effort to be able to reach out to all of, because healthcare is so utterly important to all of us in all of our walks of life. We will all come in contact with the healthcare system at one point or another, or in one way, shape, or form or another, over our lifetimes, oftentimes many different ways. That it's important that they reach out and engage the larger public as well. But when I say meaningful, it can't be that we have a predetermined outcome, and I'm going to talk to you just to go through the motions and just to say that I've engaged in this kind of an exercise. Rather, it has to be meaningful. You have to share with people what the options are, what the choices are, and listen to them. Take the time to actually listen and to be guided by the wisdom that exists in communities. The program that I mentioned in my formal remarks, the wraparound program, came as a result of local hospital officials understanding who their partners were in Timmins, engaging them in a way and developing that partnership so that they could get people who were in acute care beds back into the community with appropriate care. That didn't come as a result of a bunch of very well-meaning and very intelligent people who work at the Ministry of Health and Long-Term Care. It came as an innovation because people in a local community were prepared to listen, talk, and partner with one another. And that's the benefit of what genuine and meaningful engagement can mean, and what the power of it's going to do is to build a force within healthcare to realize the potential that we have.
I think we have time for one more question.
Sure.
I'm Doug Weir. I'm a psychiatrist. I'm also with the Ontario Medical Association. In your remarks, you mentioned mental health and addictions being a priority.
Yes.
Can you tell us what your government intends to do, especially to ensure that treatment is a priority?
I've called together a group. I've tried to be as representative as I can, about 24 individuals from around the province of Ontario. So we have clinicians and practitioners, we have community providers, we have survivors. We have tried to run the gamut across the province of Ontario toward the development of a mental health and addiction strategy for the province of Ontario. And that would be for treatment, for, I don't know if prevention is a proper term, but it runs the whole spectrum, the whole gamut of what the options are. What I've said to them is, I don't want simply the ministry to develop a strategy and for you to tell us whether you like it or where the gaps are. I want this to be developed from the people who are on the front lines, from the people who are working within the system, and more importantly, from the people that I'm going to need to rely on to help to realize it and realize it in our lifetimes. So that's the direction that we've gone in. We have reserved some additional dollars within the ministry's budget, but I'm not as concerned about that, because once we develop whatever the strategy and whatever the actions, however we're going to prioritize things, and we're not quite there yet, but whatever that is, we're going to then share that with my cabinet colleagues and with the treasurer and say, this is what we're going to need in order to make this very real, and this is going to produce the results that are going to make a difference in the lives of Ontarians when it comes to mental health and addictions. And I know that there are there are a lot of myriad issues, some of which have surfaced very early on, is the lack of capacity for children and youth, the gulf that exists between mental health on one side and addictions on the other, and how do those two interact, and many others. I'd say that our first meetings have been productive, and I'm really looking forward to what's coming out. I'm targeting the spring, probably the late spring, for when we should have a first draft to be able to share with a wider audience around the province and receive some feedback, and then we'll see where next steps are and where we take it from there. But it is a great personal interest to me. So far, I've already connected with Michael Kirby and the National Commission, and one of the things I'm really thrilled about is that the issues of mental health and addictions, in my opinion, that there is a growing public consensus that now is the time for leadership. Now is the time that we could do something, that we could really set a direction which would have meaningful consequences and see some truly transformative change. And I really get the sense that we are on the verge of seizing that kind of an opportunity. So I really thank you for the question.
Thank you, Minister. Let's give the Minister another round of appreciation.
Let me take my water.
And now I'd like to call on Alan Odette, past president of the Canadian Club, to formally thank the Minister.
Thanks, Helen. I noticed when you jumped up here, you got a lot taller. There was a really good-looking but short past president that they created that for last year. Thank you, Minister Caplan, for joining us this afternoon and outlining the Liberal government's health priorities in Ontario. As the Minister has said, for all citizens of Ontario to have a full and speedy access to the best health care possible, we need to make sure that everyone is involved in the system, including government and physicians, and that everyone is working on the same page collectively and together. So thank you for that. His ministry is aggressively setting targets with such successful programs as the wait time strategy, and this should result in Ontarians getting the care they need sooner. So we still have a long way to go. As you've mentioned, a lot of work. Healthcare will likely continue to be the biggest test governments, federal and provincial, will face. It is and will continue to be the biggest expense, no question that they all have. And healthcare won't take a holiday from this current economic turndown. At the same time, the money invested in healthcare has to be balanced against the hopes for increased funding in other areas, including education, justice, and social services. There is an Arabic proverb, "He who has health has hope, and he who has hope has everything." And where there is good, far-sighted leadership, there is hope. So, Minister, thank you for bringing your leadership and your vision to us this afternoon, and for joining us at our luncheon. Have a great afternoon.
Thank you, Alan. Thank you, Minister, and thank you to all of you for joining us today. This concludes our television programming, which is being broadcast live and will be rebroadcast in the days to come. This meeting is now adjourned.